Hi, Don here. Welcome back to the Podiatry Management Minute. I want to talk today about something called a foot treatment checklist. This is something that I put together a few years ago, basically because as I was seeing patients, especially with like plantar fasciitis and Achilles tendonitis, they come in and we just overwhelm them with so many types of treatment options. And it got a little confusing and patients really couldn't remember. I know some people use actual pieces of paper and they'll circle or check off what they're going to do. This is what worked really well for me. And I call it a foot treatment checklist. And this is like rendition number 3. The first one looked pretty bad, and now it's getting better and better. So you can see here, this is actually my older version. My new version has my HIPAA compliant texting on it. Oh, here it is. It has the text question. It has my email, my name, the patient's name, the diagnosis, the date, their pain level, when their next appointment is. So for example, if they're going to do shockwave, I'll put like 1 week, 2 weeks, 3 weeks. If they're going to come back in 4 weeks, I'll do that. I have an imaging section where I say, and I check what we did. So what I'll do is I'll put a checkbox if we did an x-ray, if we did an ultrasound. And then if I don't do it and I'm considering doing it in the future visit, I'll circle it. So I'll circle it for future things. And I talk about reducing inflammation. So cortisone, shockwave, amnio, anti-inflammatory medication, icing. Then I'll talk about learning resources, something I use called Patient Education Genius, an actual link to my website, one of the pages, how they're going to reduce tightness, such as foam rolling, physical therapy, Graston technique, night splint, towel stretch, and then how to increase stability and reduce pressure. And then there's another page of this, which I didn't include, but this is how I use it. It's called a foot treatment checklist. How did I make this? So let me explain, because I know time is of the essence for everyone. So as much as you can delegate, the better. So I typed this up in like a Word document, kind of the sections I wanted. I found someone on Fiverr, Fiverr. Fiverr is where you pay them $5 increments to do stuff. They designed it, right? Something like this. So you can take a screenshot, so share kind of what do you want, share the logo, they'll print it off. Now, if I could do it over again, what would I have done differently? I would have used a size of paper that's more common with like a prescription pad. Mine's a little bit off center, so I like leave it in my pocket. And what happens as I use it, it tend to gets bent and things like this. And on the back, I write don't tell anyone. On the back, I write my passwords that I can't remember. So that's our little secret. Okay. So how to log into different things. So that's on the back of it. So whenever I use the whatever 60 pages, then I have to rewrite. There's only one password, so I'm not gonna. I just turn it real quick so you guys can come log into my computers here. But that's it was only the password to my x-ray imaging. Okay, that's the one I can't remember sometimes, but that's what I use. Foot treatment checklist. Let me know your thoughts if you wanted to try that. Send me an email if you have any other thoughts or you'd like to try to use mine. I can give it to you. Thanks.